Suj, this is in response to your video. I do love your presentation. I like that you brought up your personal reflection about getting a phone call saying that we're getting limited on resources and how you've had to deal with that from two different areas when you were working in two different areas, I mean. I like that you brought up that another hospital might have the resources to find the cure for this patient. Just because we have, I think it's a mid-level hospital in the case study, doesn't mean we have all the options. The issue of having to use experimental medication may no longer be an issue if somebody is able to determine what is causing her lack of clotting factor. I believe it is uncommon for a 55-year-old female to suddenly have a newly acquired clotting factor disorder. I think we need to ask the question, why did she develop this disorder? Why this patient? Why this disorder? Was there something genetic? Was there something, it takes a while to investigate this, and I don't know that our hospital has the resources to complete that. It's like trying to, like I said, one example is it's like trying to figure out how to live with a broken leg. You don't live with a broken leg. You fix the leg, figure out what's going on, and then you continue to live your life without a broken leg. So there's no reason, if we can fix the problem, then we don't have to figure out how she has to live with it. I think referring her to, you call the tertiary hospital, I looked a little further, and even to a quaternary hospital, hope I pronounced that right, is a great idea. Another hospital has the resources we don't have. Her other options were primary care or rural hospital, which is taking a step backwards even. They need to, like I said, they need to be able to find the root cause disaster or just root cause of the disorder. I think that the hospital with more resources could offer her more treatment options than we have the current hospital. With quaternary care, I had to look this one up, is more specialized, that deals with more experimental medications. So if she's having difficulty, or the hospital's having difficulty paying for this experimental treatment, maybe if she goes to quaternary care hospital, which is an extension of the tertiary care, that they could be able to have an experimental drug or medication that could help her, that she could afford, or the hospitals could afford, while they're investigating and while they're looking into different things. I do love that you said when it comes to paying for the medication, I like that you brought up the idea of the payment plan for the hospital. Not that I'm a big fan of payment plans and paying interest or anything, but hospitals might not be able to afford the expensive medications all at once. If our hospital is, having to take that great big pay cut from, I can't remember what it is now, $1.7 million, and we're only getting paid $42,000 for it, we're going to need a payment plan system or something. Now, that might make us in debt even longer, but at least it's not forcing us to close our doors. I think that also if the patient had to pay for it, it's a great solution. We use the payment system to pay for our houses and our cars. There's no reason we shouldn't be able to do it for medications. Overall, I think you thought you had a great post, and thank you for listening to my response.